And we are live.
Dr. Jamie.
All right. Hey, Fab Squad. It's Dr. Jamie, your lifestyle pharmacist, and it is time for another episode of Live with the Fab Squad. Yay! I'm super, super excited to be back for the month of July. I've gotten your emails, your text messages, your DMs. Like, Dr. Jamie, we were doing this thing like pretty regularly. We're still stuck at home or trying to stay home, more. Let's keep the broadcast going. So guess what, Fab Squad, you asked and now you are receiving. I love connecting with you. And so thank you all for giving me that little push, that little poke that I needed to get us back together sooner. So, what are we talking about in this episode? We are talking about how you can understand health disparities and what that means. So that is our topic for the evening. And we have a very special guest with us, one of my pharmacy school colleagues. We actually attended Xavier University of Louisiana College of Pharmacy together. We were not in the same graduating class. However, we were there at the same time.
Yeah.
I have Dr. Stephanie Young Moss here with us. So Fab Squad, give her a warm welcome. Hey, Dr. Stephanie, thank you for saying yes to coming inside the Fab Squad with us tonight.
Well, thank you so much for the opportunity. I appreciate it. You've had some great people on here, and so I'm really, really honored to be one of those as well.
Oh, yay. So tonight's topic is one that you are very familiar with. I see a lot of things that you share and post, and the way you have been so passionate about educating everyone about health disparities and really what that means. So when I was thinking about who I wanted to share the platform with me tonight to talk about this topic, of course you were top of mind.
Thank you. I appreciate
it. So yeah. The Fab Squad is going to be coming on in. We actually started a few minutes early, but to be early is to be on time. So, we were on time and a little bit early. So they're going to be coming on in, but out of respect for everyone's time, yours and mine as well, I want to get into the topic. So just so that everyone is crystal clear, we are talking about understanding health disparities. So, Dr. Stephanie, I want you to introduce yourself. I did like a little, something, but I really want you to tell the Fab Squad who you are and, all the ways that you are an amazing and incredible pharmacist. So let us hear exactly what you're up to.
Well, like you said, I am Dr. Stephanie Young Moss, and I'm the creator of drstephanieyomo.com. I am a pharmacist, and I am actually a health, economic, and outcomes research pharmacist. So I specialize in leading health, economic, and outcomes research when it comes to various disease states. And I've been doing it for several years and I enjoy it. But I do have experience in community pharmacy and also a lot of experience in managed care as well. But one of my passions is also trying to eliminate health disparities. So I do that through some of my wellness education that you'll see on my website and on my social media platforms as well. So that's one of the things I'm really passionate about, and some of the ways that I also work in the community as well. So I'm on a few of organizations that's their main focus and job, and that's one of the ways that I love giving back.
Awesome. So where do you live? Where are you located?
I'm in Indianapolis, Indiana.
Indeed.
I'm from Tennessee. I'm a Tennessee girl.
You know what? I was so pleasantly surprised to find that out just randomly when you shared like some, fun facts about yourself. And you said that you were from Tennessee. I was like, no wonder I like her so
much. Chattanooga, Tennessee. But I've been in Indianapolis for several years, like 20 to be exact. But
wow. Girl. Cool. So you have a very interesting background in health outcomes, managed care. You're on several boards. Like, how has the work in your professional life, how has some of the things that you have done professionally really like fueled this passion that you have in terms of your interest in educating others on health disparities?
Well, when I first got out of school, I did work part-time for a community pharmacy when I started my fellowship in industry. And working in community pharmacy, you see the health care disparities there. You see who comes in with the medications and how many medications they have, the polypharmacy, having several medications. So you see all of that. And then also working in managed care, you would also be able to see the numbers as far as the people who did not have insurance. So I really focused on that portion while I was in managed care. So whatever arena I was in, I was able to see and try to focus on some of those disparities and ways that I can help. So whether it was community pharmacy or managed care pharmacy. And then when I moved to health economic and outcomes research, of course, we know when we have our clinical research trials and even some of our health economic outcomes research trials, a lot of times people of color are not as representative as much. So how do
We
we
are not, no.
not at all, especially compared to the population. So how do we know that these drugs are actually even effective in that population? So health economic outcomes research is after the drug is approved, after the clinical trials, how is it actually working within the community? How are people actually using it? And is it actually doing what it says it should do? So my goal is to try and make sure that we are also focusing on people of color in that as well. How are we helping them? And how is it working different in those populations as well?
Wow, that's awesome. And we see and hear, I think, more information about, participation in clinical trials now.
Right.
And, there is still some apprehension. There's some things that have historically happened in the African American community that have made, many people very, close to the idea of participating in a clinical trial because historically we have not always had the best experience.
Exactly, exactly. So, and of course, we know there is a lot of bad history there. And not so long ago, I think I just posted yesterday about the Tuskegee experiment. I mean, that was ended in 1972. So, I mean,
Yeah.
that was not that long ago. But with health economic and outcomes research, it's typically a lot of times is looking back retrospectively of what drugs had already been prescribed. So it's drugs that are on the market and already prescribed. How is that working? Is it really helping the population? Are they actually being able to go back to work sooner? Are they actually working when they're at work? Are they actually doing a job that they can do? Are they spending less money in the ER? So those types of things, that's what I look at.
Oh, that's incredible. That is such a huge need for that. And I'm glad that you are working behind the scenes for us.
Yes,
That's incredible. Yeah, talk about representation, having a seat at the table. But that's another topic. Sorry, but I'm getting so excited. So, like in this season of coronavirus, the word health disparities is floating around everywhere. It's on our social media timelines, it's in articles, publications, front pages of, different blogs or even, newspaper outlets. And people are hearing the term, but may not be crystal clear on what exactly the term health disparities means. So can you spend a few moments just kind of, educating us on what health disparities are? This is not just like a buzzword.
Right, exactly. So health disparities is a preventable difference in the burden of disease or being able to actually achieve optimal health in certain populations, especially populations that are socially disadvantaged. And that we would could be race, it could be ethnicity, it could be gender. So any of that could be tied back to that. And this all ties back to an equitable distribution of our resources. So how are we using our resources in the community? So it's not just a difference in your genetic or your race, because there's no difference there. It's a difference in how we're using our money in the communities, how we're using those resources by the government, what types of things are going on in our neighborhoods, how are we educating people, do they have an education, are they living in poverty, do they have access to health care? So all of those things contribute actually to health disparities. So that's what health disparities is.
Wow. So in my preparation for sitting down with you,
Mm-hmm.
I was just blown away at some of the stats, the number, the data. And I know that you are a very data-driven professional. So, let's talk about some of these startling and very jaw-dropping statistics that really help to frame what these health disparities really look like.
Mm-hmm. Well, there with every disease state, you will see some type of healthcare disparities. Some of the ones that I have recently talked about on social media, you will see that African Americans, we are typically 10 times more likely to have a limb amputation. So if they 10 times, yeah, 10 times, not five, just 10 times, which is a lot. So
Wow.
patient has diabetes, they're typically 10 times more likely to have amputation compared to non-Hispanic whites, which is a lot, and that's a lot. So what is it? It's because they did not have preventable care, so therefore their disease was out of control. So then they were, a candidate for that amputation. What would they not? Could they not afford their medication? So we have to figure those types of things out to see why we have that type of disparity. Then also with childbirth, a lot of people will say that, well, is it just because of maybe the person couldn't afford it? Maybe it's because of poverty. But when you look at um, pregnancy and dying during childbirth, there is a 5.2 times more likely chance for a Black American woman to die during childbirth versus that of a non-Hispanic white woman. And
In America today,
yeah,
right now.
that's regardless of your education. We have one of the highest mortality rates when it comes to death during childbirth. So that's regardless whether you're educated or not. So even if you take that out, we are still 5.2 times more likely to die than those of non-Hispanic whites. Yeah.
Wow. And then something else like, you know, improper pain management.
Mm-hmm.
Living with chronic pain is something that it decreases, quality of life. Of course, is associated with increased, morbidity and in some cases even mortality, just because of all the things that kind of start to happen as a result of trying to, live with that chronic pain.
Mm-hmm.
And one thing, speaking of pain, that impacts our community, is sickle cell anemia. Sickle cell disease comes to mind. And, pain crisis
Yes.
is a hallmark of that process.
Mm-hmm.
So, what about, how does that even factor in? What are some stats are there some stats surrounding like disparities and even the way, we are treated or the management of pain in people of color?
Yeah, so people of color are typically, well, I'm going to say people of color, but Black Americans are typically receive, they're 50% less of a chance to receive a pain medication versus that of non-Hispanic whites. So when they come in, are they believe that they have the pain? Are they believe they're actually in pain?
Or are
So
they drug seekers?
they drug seek. So are they being
Yeah.
stereotyped? So we talk about
Yeah.
health disparities, but this is also some things that you will see when it comes to being racially biased. A lot of times you'll see that they're being racially biased against these patients where they're not receiving the pain medication that they need as well.
Wow. Oh my gosh. So I don't want to make this all about COVID, right? But one of the things I can say that this pandemic has done was that it has put the inequalities that exist in America like on full display for the entire world to see, right?
Right.
And so, I guess that can, depending on your perspective, that can be something positive that has come out of this pandemic because more people are aware, more people are paying attention, more people are asking questions, more people are feeling the need to try to do something to, effect some change.
Mm-hmm.
So let's discuss some of the factors that, we have heard and have seen the data, and it's on the news like constantly about the way that, African Americans are impacted, by coronavirus. There are some very drastic differences in the way that we fare, from coronavirus than others.
Right. So when it comes to some of the statistics that you see, and these change, probably monthly, or probably even daily, they change a lot. But African Americans are 5 times more likely to get COVID versus non-Hispanic whites, and 2.6 times more likely to die from COVID versus non-Hispanic whites. So that's a large disparity there that you see. So why is this? I mean, yes, you'll see that there will be some factors that play into it, like health disparities, where we have 40% more percent greater chance of having hypertension, not greater chance, have 40% more cases of
Hypertension.
and then also 60% more of diabetes, and that actually contributes to negative outcomes of COVID. But it's not just that; it's also your access of health care. Are they able to go to the doctor? Were they able to get tested? Let's talk about Shelby County. You're in Shelby County, right?
I am. Let's talk about it. I am.
Well, when Shelby County, which is Memphis, Tennessee, when they saw an uptick in some of their COVID cases, they actually started to test more, but they started to test more on the east side of Memphis, where a lot of their facilities are. Well, guess who lives east?
Not us.
Not us. Exactly.
Not in great numbers. I mean, there, a few of us are
Oh,
out this way,
okay.
but not the majority of us.
Not
No.
the majority. They don't live on the east side of Memphis. So
Right.
once they saw these numbers and they realized that people who would live, most of the majority of Black and brown people live on the west side of Memphis, they would have to go all the way east just to get that COVID test. So they started seeing the numbers and seeing that disparity, and then they started putting more on the west side. But that's a great example there, that there wasn't a lot of testing centers for them to even be able to go to,
Yeah.
for to be able to be tested. Then
Right.
also, a lot of the workers who are, a lot of people don't have the ability to stay at home and to socially distance or socially isolate themselves. They had to go to work. In New York, 75% of frontline essential workers were Black and brown people. So they
Yeah.
had to go to work. They had to expose themselves if they did not have the proper way to not expose themselves. So it could be, whether it's post office workers, it could be people who were home health aid. So they had to expose themselves and be able to go to work to and put themselves at risk. So they didn't have that luxury to be able to do that. So those are just some of the factors that you'll see, why you'll see some of those differences there with COVID as well.
Wow. Yeah, and just thinking about, the frontline essential workers, of course, in healthcare, since I practice clinically in a hospital, all of my, hospital colleagues in all capacities, whether it's, the wonderful people that work at our information desk,
Yeah.
even our environmental services team that keeps the environment, welcoming, and, that's like the first thing that people pay attention to. And so, in healthcare, all roles are equally as important. There's not this, oh, if you're not the physician or the surgeon or the pharmacist or the nurse, you don't matter. Every single person, our food services team, respiratory therapy, like everyone that works in, I'm just thinking about all the people that I encounter in the hospital every day, and there's, a difference even in pay, even in those roles that I mentioned. And so just thinking about the people that have to go to work in many of these cities are not people that have the luxury, as you mentioned, just to stay home. Bus drivers and people working the subway station, even Uber drivers and Lyft drivers, and all of these jobs don't pay a hefty amount of money, and not everyone has, vacation time or, sick time that they could stay home,
Yep, exactly. So we even have a larger percentage of jobs that may not provide adequate health care. So if you want to go have preventative tests or preventative care, a lot of times you may not have access to that, which makes your disease worse, will then put you at risk for having negative effects of COVID as well. So those
right.
things that some of the research that I've seen out there currently with COVID, and like I said, it's changing all the time, but that's what we're currently seeing now.
Wow. So as pharmacists, I know we have some of our pharmacist friends, tuning into the broadcast, and even more are going to catch the replay because some of our peeps are still at work, in the community or even in the hospital. But as pharmacists, this question is for all the pharmacists out there. What's up, pharmacists? As pharmacists, what can we do? Health disparities is a large issue, right? And people want to get involved. So as a pharmacist, what can our pharmacy colleagues do to try to provide some solutions, some support, and even some help to ending these disparities?
Well, besides being your great, lovely, unbiased self at work when you come in contact with patients every day, of course you can do that. But besides that, you can also advocate for affordable health care. I mean, I think that's a really good way, whether it's on a board position or just volunteering in community. I think that's a very good way to actually help as well. Then also, we need to make sure we have diverse healthcare professionals. I think that's very important. Pharmacists, and I wish I had the statistics beforehand, but I'm not sure exactly of the amount. And of course, we know a lot of people of color that are pharmacists, but we need to see more pharmacists as well working in the community and working alongside these people as well and caring about those people. So no matter what color you are, you still should care and help as well.
Yeah.
We also need to make sure that we, an acronym that I like to use when it comes to decreasing healthcare disparities is love.
Love, like the word love.
Yes, so using love to decrease healthcare disparities. We need to make sure that we're listening to the patient, listening to what they have to say, and not treating them as just a statistic in a book. Also, making sure that we're learning from them as well. So once you listen to them, make sure that you're learning from them as well, because you can learn a lot from them. Yes, you have the pharmacy degree or the medical degree, but you can also learn a lot from them in their because they're make sure that you're culturally competent as far as what's going on with them as well. And then once you listen and learn, you need to make sure that you observe. So if you see anything within you that you may see that's a difference, sometimes you may have a racial bias and don't even realize that you're doing it, but you need to observe what you're doing and then try and omit that from your behavior as well. And then also you need to make sure that you value your patients, value all of your patients that come in. So value their lives, value their opinions, value their point of view, and then also become vulnerable with them. So don't just, I know that we get so busy in pharmacies, especially a lot of the pharmacists is so hectic and so busy. And they're probably thinking, I just want to make sure I'm getting the correct script out. How can I let my guard down and talk to them? But there are ways that you can also make yourself vulnerable and ask them about their day and also talk about your day as well. And then E would be make sure that you educate yourself, whether it's reading books, Googling information that talks about health disparities so that you can equip yourself with it as well. Then also empathize with your patients as well. I think those are the things that we can do as healthcare professionals and pharmacists to really try and help decrease those healthcare disparities.
Yeah. I'm glad you brought up bias, because bias is there. And even there's some wonderful commercials, and I'm blanking on which company is really like running some amazing ad campaigns on the subject of just bias. And one of the commercials that really jumped out at me was an African-American man, and he was just going about his normal day. And he was getting looks and stares when he was going into stores, and when he was crossing the street, people were trying to get away from him. And he was at a swim lesson with his son, and people didn't want to get in the pool or even interact. And it just kind of watched his daily activities, and ultimately he ended up at work, and he ended up being the judge on the bench. So imagine, the clerk says, "Please rise, the honorable whoever." And when the camera goes back to the judge, it's the same Black man. And the subject, and then something about bias came up at the very end.
Yes.
And I was just like, oh my gosh, this is just the perfect illustration of everyday encounters. And people are not always even aware of the bias that they have. And I know this happens in healthcare. There are, more conversations starting to be had amongst some of the professional organizations. I know the American Medical Association is really taking some time and, putting some initiatives together and releasing some statements. And the American Pharmacists Association is starting to follow suit and, participate in some efforts in our profession as well. But yeah, unconscious bias is real. And I wasn't surprised, but when I started like reading more and seeing the numbers, it's just the numbers that almost jump off the paper at me, just the differences in even medications that are prescribed for, common disease states where there's evidence-based, protocols that are out there. And not everyone even gets offered the medications that the clinical trials say are the, highly recommended or the gold standard for a certain disease state. And it's not even thought about. Assumptions. Oh, well, that person isn't going to take the medicine. They're not going to be compliant. They probably can't afford it. Like just all these things, come into play even when making clinical decisions for some patients. So
go ahead.
So I just, this is one of those opportunities for everyone to stand in front of the accountability mirror and look at yourself, because this is self-work. It's not all about someone putting you on blast and finding you on Facebook and outing you and you getting fired from your job. People need to stand in front of the accountability mirror and take ownership of the things inside themselves and be committed to making that personal change. And then sharing it with other people. Like, I realized that I was unconsciously doing this. I was biased in this way, and this is what I did about it. And having those honest conversations with peers, colleagues, family, and even friends.
I agree. And I think even as we have to look internally and start there. And of course, I mean, it's not going to happen overnight. I mean, you have to work at it every day. So do something every day to try and help yourself if you realize that you may have these things. I may even be interacting more with the community. That also helps as well. But I think even as organizations, they have to do things as well. So whether it's hospitals or pharmacies or whatever, they have to make sure that they make it a priority.
Mm-hmm.
Look at it and see how can we either help increase health equity or decrease disparity by getting rid of some of these biases. So that comes in form of training. And once you train your staff, make sure that you're measuring to make sure that it's actually taking effect. I think
Come
that
on, that measurement and accountability. I hear you.
can't just train and not know if it works or not, right?
Right.
And you also have to have collaborations. You can have collaborations within the community. If you're an organization within a community, reach out to grassroots organizations within that community and do things with them, such as a health fair or a food giveaway or information or anything like that. Try and work with those in the community as well. And then also engage within that community. I think that really helps as well. So, and then make sure that your staff is a representation of the community that it's in as well. So when people come in, they see someone that looks like them, right? I mean,
Yes.
you should be able to have that feeling when you walk into a doctor's office or a hospital. Try and have that representation as well. I think that's important. So not just internally, start there, but organizations also need to see what can we do as an organization to try and decrease some of these biases too.
Absolutely. Absolutely. So I'm looking at some of the comments and people are loving. I'm going to share this comment to the screen.
Mhm.
The love. Thank you, Kristen Amber. She put it all out there. So everybody, love. That's how we can start working on ending disparities using that acronym.
Thank you, Kristen. Thank you.
All right, so I think we kind of touched on what citizens can do to also help with this problem, like, working in the community and, standing in front of that accountability mirror and looking at self. That was one of the other questions that was asked by the audience.
Okay. Mm-hmm.
This is some good stuff. All right, so health and wellness
Mm-hmm.
is a passion that you and I share. So I can't have you on with the Fab Squad and not get your tips. Let's say maybe your top three. If you had to pick three, Dr. Stephanie, just three, what are your top three tips for families that are really wanting to improve their overall health?
Well, I think it is important to, first of all, approach it as a family because if one person is buying bulk junk food, yes, you're probably going to eat it, right? So it's probably great that you try and approach it as a family. It's kind of hard to do it one on one. And I'm still working on this myself. I'm not perfect. I'm going to say that. There's still some things that I need to take out of my diet and even out of my kids' diets. But I think that first, I think you need to start with trying to at least being more active, at least moving 30 minutes a day. I have my little watch here, and I have a competition with some of my friends where I try and get in at least 30 minutes a day, and we can kind of hold each other accountable. You can also do it with your family members as well. Just even asking. Everyone doesn't have Apple Watch, but if you can ask, hey, did you get your 30 minutes in today? Did you work out today? Did you even walk today? I think that's start increasing that movement. And then even don't sit as much. That's a really big people don't realize that just being sedentary and sitting all day, especially a lot of us have been working at home for a long time. You need to make sure that you're moving too. That's important. Stand up. So instead of sitting down to take that meeting, stand up and take that meeting. That helps as well. And then also make sure you have a balanced diet. Of course, we know that's important. I'm not saying cut out everything, but try and increase your green leafy vegetables more. Have more of that on your plate than you do other things. Decrease some of your protein. I'm not saying cut it out and become vegan or vegetarian, but try and decrease those things. So just do some healthy swaps, of course, with some of the food that you eat. And even make some of the meals that you may like, some of the soul food that you may like. Find better cooking. So with my greens, use pork in it, and I grew up on that. But instead, I'll use.
Amen.
So instead of using that, I actually use the turkey products. or I just use vegetable broth, and it tastes the same. It tastes good. You
Yeah,
just have to try it and get that recipe right, and know what you like, and then those are some of your healthy swaps that you can do as well.
I love that. So Fab Squad, I hope you heard some things that you had heard before. See, Dr. Stephanie, I like to always ask a healthy lifestyle related question
Hmm.
from my guest, whoever it is,
Right,
just so the Fab Squad hears it from another voice.
right, right. I
So
think
I know y'all have heard these
it
things
takes a long,
before.
several times for you to hear something for you to get it right. So
Yes.
repeat it to myself to make sure that I'm getting it too. So I still need to go work out for the rest of the day. So
I love it. I love it. Yeah, I have not exercised today myself. We got some rain here today, so it kept me in. And then my dog went to training, so I missed walking with him this morning. But
yeah, I
the
typically
sun,
try and get it in the morning because if I don't, either you get busy, you get tired, and you either forget about it and say, "Oh, I do it tomorrow, I do it later." But I have to hold myself accountable, and I have people that would text me and say, "Hey, your numbers are kind of low. Uh,
right,
exercise. What you gonna make it by midnight?" So I try.
right,
In, but I do like to get it in early in the morning. And I'm gonna be honest, I used to go and work out with my trainer, and I still love her. She is the best. Shout out to Fit with Renee. But I actually like working out online now. Like I'm not really ready to be all in. So
yeah,
that's more to be able to just pull up something or go to her classes online and get that in or find something on YouTube and
yes.
ways.
I've been seeing you because you were working at doing some workouts from this trainer in Atlanta.
Oh yes, Affect Fitness.
Yes, and I keep saying, okay, Jamie, do one, do one, do one, do one, do one. They look so fun. They are very high intensity, but I'm up for the challenge and to mix it up. But I like what you said. Opening up your phone, your laptop, your tablet, whatever, going to YouTube, or even Googling your favorite trainer. Or there's just so many options out there for people to take advantage of trying new fitness things right now at home. So I love that you shared that.
Yes, love it.
Love it, love it. All right, so let me get back on topic, but I just had to throw that out there so the Fab Squad could hear some healthy tips from somebody other than myself. But anyway, our topic is health disparities. So let me get back on topic.
Mm-hmm.
Okay, so in this awakening that so many people in the world have had, and even some people in our communities, have had, colleagues,
Right.
neighbors, people are really wanting to step into this role of being an ally, right? And advocating and just, using their voice or even the opportunities that they've been afforded in life. You might call that privilege, using that seat of privilege that they have had to do something and that they still have to do something positive with it.
Right.
So, what how can we communicate, or should we even communicate to people who are wanting to join in, the fight and be allies in, eradicating health disparities, even in the Black Lives Matter movement? There's all this talk about allies. So even, as an African American woman, how do I still feel like I should be open and even willing to be collaborative, even when people that approach me. I'm not going out approaching people, trying to change their mindset, but people are approaching me, asking me, Dr. Jamie, as a white woman, what can I do? What should I do? So can we spend just a few moments just talking about, allies and how, we can be open, I guess, as the start.
Right. Yeah, I think, and I speak for myself, not for the entire Black community, but
Yeah.
what I think is that opening up those conversations, whether it's by phone, I have had a few people to call or text me and ask my opinion on certain things. I think opening that communication is important and not shunning someone if they ask you or if they ask you a certain question. They may ask you the wrong way because they don't know what to say. So I think
Yeah.
it's important to have that dialogue, private first for me if they're uncomfortable and not don't know what to say at first. So I do like when people come to me and want to ask me certain questions or what can they do. I don't mind them coming to me and asking me certain questions. So I like having that dialogue at first open. and talking to your friends who may not look like you or have different experiences than you do first. I think that's so important for us to do that. And we've had some of those conversations, of course, with some friends that we have, and it's been it's been good. We've learned a
Yeah.
lot. It's actually made us, I think, a little bit closer as far as how we're able to talk and things we're able to say to each other as well.
Yeah, I agree. I agree. So we kind of touched a little bit on like geographic location and like education, race, and ethnicity. Those are often implicated in disparities.
Right.
But this is such a complex issue. It feels so large, and maybe even impossible or overwhelming.
Right.
Like I know that we can't turn all of our communities around
Right.
and remove poverty and make all the schools equitable right now, although those are things that we strongly desire and we need. People just want to do more, and I know that you shared love, the acronym love, but for example, for the college student that might be tuning in, they're home, they're uncertain if they're gonna go back to campus. People want to get involved. So, what are some things maybe that you have seen in terms of like community engagement where anybody can just jump in and just
Right.
to do something?
Mm-hmm. Well, I think that you can volunteer. It may be either at a especially if you're a pharmacy student. You talk to some of the pharmacy students. There are certain organizations where you can go and volunteer to be able to help, whether it is helping with dispensing medication as a tech-like position, or whether it's educating some of those people and talking to them as well, and getting to know people in those communities, because building a healthy community also builds healthy individuals. So go back to those communities and find organizations in your community where you can volunteer. I think that's very important. So that's kind of how I started off with just volunteering. We have a organization here where I was able to volunteer as a pharmacist, actually, where they give out free medications. And we had some students that would come there, and they were actually techs and help dispense the medication. I would check it for them and then give it out and counsel the patient. So that was one way to do it. And then also educating yourself as well. So call up some of the local organizations or local clinics and see what volunteer efforts they need. So they need volunteering hands on deck, and they also could possibly need funds as well. So figure out if there are fundraisers that you may be able to do in those areas as well. So just building that community, helping in those communities, and making those communities healthy will help
Yeah.
individuals become healthy as well.
Oh, I love that. And I love how you tied in, pharmacy students and, pharmacy students and medical students, nursing students all have knowledge. And I don't know if students often give themselves enough credit for the things that they have learned. And for those that have started their clinical experiences, towards the end as they approach graduation, they have even more knowledge. So yes, students, you all are such a valued asset. You can volunteer, you have medical knowledge, so reach out to some of these organizations like Dr. Stephanie said and be of service. And even if for those who are not in the healthcare space but are at home and want to help in some capacity, you mentioned donations.
Yeah, and there are even volunteer positions. You don't have to be a medical professional to be able to volunteer at these clinics and different things. They have other things that you can do there.
Can do.
Yeah, there's other things you can do. So don't think that you just have to be a medical professional to be able
To do it. To do it. I love that. So everyone can do something. Like if we all have to be committed. We can't just, be on our phones and be online activists, letting those Twitter fingers and Instagram fingers and Facebook fingers go to work. We have to put some action behind, the things that we're feeling, use the emotion, use the experiences, use what's happening to be that catalyst to make us all want to do more, because we each can do something, and we all should feel hopefully compelled to try to step out in some way to help during this season especially.
And it may even be just educating your circle that you're with on something that you're reading or something that you learn, maybe something you learned today. Going back and educating your circle about that as well also helps and start to make them think as well and make them want to do something. So I think that's very important as well, as educating your circle.
Yeah, I love that. And so that reminded me to invite our audience to share this broadcast. So, we're trying to understand health disparities better. Of course, the goal is to try to eradicate them, and taking the information that you learned today from Dr. Stephanie and sharing that with your family, with your friends, with your church members, with some colleagues, people in your community or in, social groups. Share the information. Share. So just hit hit the share button on this broadcast and share. Okay. Thank you for that.
You're welcome.
So what else? Oh my gosh. You mentioned access to care.
Mm-hmm.
And so there is access to care or in access to care, and then the whole high quality care and the access to that. And when you were talking about East Memphis, it made me think of something. And, the specialists in a lot of cities are located in certain parts of the city. Mm-hmm. And for example, cardiologists, heart specialists, endocrinologists, physicians that specialize in managing, diabetes, and that's a disease state that greatly impacts African Americans. The point in this discussion is that access to that caliber of healthcare, the specialists, is not accessible. It's often across town. People have to take, 2, 3 or more buses, sometimes to get across town to even be able to see the specialist, right? So access to high quality care, and even in like some hospitals, like in rural areas, the specialists are not always there. And hospitals in certain zip codes, certain communities, the specialists don't see patients in those locations. So, access to high quality healthcare and being able to see a specialist impacts, disease states that plague, people that look just like you and me.
Right, it does. So that's one of the board that I'm on is actually a health clinic in Indianapolis, and they have great facilities and clinics all over Indianapolis. And it's in the areas though where they are serving the underserved. That's one of their main goals, is to serve the underserved. And it not only takes support from the public and also private donors as well. Like that's very important. But they have great facilities in this area. So typically, if you're in a certain area of town, you're used to going to places that may not have the best facilities. They may be old. They may not have the best doctors there. But one thing that this facility does is that they have up to date technology. They have some of the best doctors. They have translators there. They have competent physicians, nurses, doctors, front desk, people who work at the front desk. And they have people that work there that look like the people that come there. So they have a conscious effort to make sure that they're doing this. So that's why I said that it comes from also the corporations and the systems to make sure that they are serving these areas and not just giving them, sometimes they may be underfunded. So they're doing what they can. So I'm not saying that they aren't. But it takes a conscious effort from the community to come around these types of organizations and make sure that they are providing that type of care. So you do have to have that patient-centeredness and be culturally competent in your community for these organizations and for these clinics. So that's one thing that we're doing at the organization that I'm at, and I think they're doing great things.
That's awesome. That's awesome. Well, Dr. Stephanie, I am a woman of my word. I said that I didn't want us to go beyond an hour. I thank you so much for spending time with us and sharing, your expertise with us. You have a very unique background. In addition, to being a pharmacist, you have a very, unique perspective, and you do some very unique work out in the community and in your professional job. So I just want to thank you again for taking the time out to share with us. And before I let you go, do you have any final closing thoughts or remarks you want to share with the Fab Squad?
Just to make sure that people are starting and taking it one day at a time. Like I said, it didn't get here overnight. The problem didn't get here overnight. So we're not going to be able to fix it overnight. So just make sure that you're doing something every day, whether it's to help the community or to also educate yourself on what you can do to try and help decrease health disparities. So it's going to start with you.
I love that. Do something every day, whether that's talking to someone or
Educate.
working on yourself.
Yeah. Mm-hmm. Yep.
Wow, I love that. Well, I look forward to continuing, conversations with you. We have some things that we're, collaborating on, and we're in some groups together. And I just look forward to everything that you have up and coming. And I just want to thank you, Dr. Stephanie, for spending time with us again. And Fab Squad, be sure that you do what? What is your homework? You have homework. There's just one thing I need you to do, Fab Squad, and that is share this broadcast. All right. Until next time, Fast Squad, I love you. I'm Dr. Jamie, your lifestyle pharmacist, here to keep you fit, fabulous, and fulfilled without those prescribed pills. And I'm trying to make your time at home during this pandemic as educational and enjoyable as possible. Bye, Fast Squad. Bye, Dr. Stephanie.